Clinical feature of a new tuberculosis usually mimic multiple other diseases as well. The foremost and more common is usually involvement of a monoarticular joint. That means that it only involves a single joint. Usually it can be bilateral and it can be involvement of other joints as well, like for example lower back pain as well, and involvement of lower spine. But usually with most common, if it's involving knee, it's isolatedly involves knee. The most commonly clinical features are early clinical features when there's just reactivation of the latent infection. Usually involves, for most commonly, is pain and limp. Patient may have a mild, a dull aching pain, and with the pain, although he or she is able to carry out his or her activities of daily living, but that actually produces limp because of the pain as well as the swelling. And the second most common feature is actually the swollen joint. Usually pain, swelling with a limp, and with a previous history of tuberculosis, most clinically, the first thing which comes to your mind is always the tuberculous arthritis. But at times pain and limp can be common in multiple other causes as well. Similarly, swelling is not isolated to a tuberculosis. It may be present in multiple other diseases like inflammatory arthritis of the knee joint as well as other joints. Therefore, sometimes it's very difficult to clinically put in with this kind of picture, and especially when with the history you do not have any history of tuberculosis in the family, patient did not have any history of pulmonary tuberculosis. Therefore, then diagnostically it becomes difficult. And there has been case reports in literature in which there was previously patient had no history of pulmonary tuberculosis, there was no family history of tuberculosis, although that patient happened to be of an origin of a country which was endemic for tuberculosis, but there was no previous history, and even the Monto test was negative. But despite the patient continued to have a limp, pain, and swelling off and on, and after 6 months to 8 months, once the biopsy was done, it came out to be tuberculosis. So sometimes the nature of the disease is so indolent that it's very difficult to exactly pinpoint that this is tuberculosis or it's not tuberculosis. Other early clinical features include low grade fever. Patient usually complain because it's a systemic disease. It involves other parts of the body as well. Therefore, low grade fever, myalgias, arthralgias, it's very common, especially in the early stage of the disease. And then thigh muscle gets wasted. Why? Because it causes myositis as well. As I told you, it can involve other joints. It can cause involvement of GIT as well. Miliary tuberculosis is very common. GIT obstruction is common. Cerebral symptoms can also come up if this tuberculosis starts invading cerebrum or cerebellar hemispheres. Therefore, patient can have a varied presentation. But if it sticks to osteoarticular manifestations, they may include arthralgias, myalgias, and thigh muscle wasting as well due to myositis. And then because there is swelling, there is underlying inflammatory processes going on. Sometimes the reaction to that is such that knee feels quite warm along with the swelling. Once you go in, this usually synovial thickening is not very apparent on clinical examination, but this is if we go for arthroscopy of a swollen knee joint of unknown etiology, and usually the first thing we see is that it's called as there is massive synovial thickening, and there is whitish plaques which can be seen over the synovium. If you see this clearly, you can appreciate there is actually the synovial plaques which can be whitish in appear. This is due to the caseous necrosis which has occurred and granuloma formation of the tuberculosis. There was another term which is called as presence of rice seeds. Now, what is that? It's basically these white plaque are sometimes 3 to 5 mm in nature. They may be large or they may be small as well, and they may be multiple as well. Therefore, Usually when the arthroscope is done, the first thing you see is as if the knee is studded with all the rice in the knee, but these rice are actually these cases necrotic plaques of the or granuloma formation of the mycobacterium tuberculosis. And then once the swelling sets in, because the pain and lymph is there and swelling, due to swelling the movement gets restricted. Usually when these patient presents, there is a history of chronic pain, lymph along with the swelling and warmth as well. And as the time has progressed, there is a gradual decrease in the range of motion. And when the patient may present to you, there may be a lot of, there may be a presence of flexion contracture over there. There may be a massively decreased range of motion, that is flexion extension. The knee may be markedly reduced, and but the problem is that this may have resulted in due to swelling, or this may be due to underlying contracture which has formed over the period of time. Then late clinical features. As the arthritis sets in, then this results in different, as there initially synovial hypertrophy, then a synovial infiltration once happens to be too much, other tissue starts to get invade, and when the subchondral bone and arthritis starts to happen, then the late clinical features of joint surfaces which gets eroded or starts to appear. When you get an x-ray, initially it may be totally normal, but in the later stages there is actually cavitation formation, and cavities get formed into the subchondral bone, and this is due to the erosion of the cartilage as well as the subchondral bone which may be involved. Then knee joint may become deformed. Deformation may be due to because of the involvement of contracture. Once the contracture, for example, a fixed flexion contracture has formed, this will result in a limp and leg length discrepancy as well. And patient may be limping due to the one leg has shortened due to the contracture as compared to the other leg. And at first glance, it may appear the problem may be at the hip joint or the knee joint, but actually the problem is due to the contracture which has happened due to the fibrosis, which is an end stage fibrosis of the tuberculosis infection. Then patient may present with subluxation, which may be posterior or lateral. Why subluxation occurs? Once that synovium has involved and the other tissue starts to involve, like for example intra-articular ligaments like ACL and PCL, or extra-articular ligaments like lateral ligaments or the medial ligaments. Once they starts to involve, they eventually results in inflammation of the ligaments, and they may rupture over the time, or they may become lax. Due to this laxity or rupture of the ligaments, this results in the posterior lateral subluxation or even dislocation of the knee joint as well. And even the patient, at times it's seen that the patient's actual presentation was a dislocation secondary to trivial trauma, but once it was further investigated, this resulted in eventually happened to be a tuberculosis. Then patients may have the rotational deformity as well, depending upon, it could be external or internal rotation, but usually external rotation is more common with tuberculosis. And then fixed flexion deformity, which may eventually be leading to LLD or limb length discrepancy, and patient may be walking with a limping gait, and eventually may be having a pain of the knee as well as the hip and the ankle joint as well, due to disturbed biomechanics of the limb as a whole. And body postures, the patient may be having a problem because a lot of weight may be going towards the other hip, knee and ankle joint.